It is extremely important that when someone gets identified with a cardiac condition, and we should really strive to do that with every single individual, that we provide them with very individualized and tailored advice as to what sort of exercise and how much exercise they're able to do. And by providing them with such tailored exercise, we're able to give them specific advice that our patients can actually follow. And when they've got specific advice, they're more likely to follow that sort of advice, and they may also be more likely to do the right sort of exercise that will reduce their overall risk of other health problems, but will also help them a lot with their psychological status and in general with their quality of life. The paper that we did a couple of years ago was referring particularly in young individuals with congenital heart disease, those individuals who have the atrial septal defects or the ventricular septal defects, of more complicated problems with their heart. And the point we were trying to make is that once you identify a young individual with a cardiac disease, then you need to take into account the available evidence in the literature regarding exercise in that particular group. Then you need to take into account the individuality of that particular patient. You need to make an assessment, an initial assessment of that individual. How fit was he before he was diagnosed with a condition? And then you need to advise them as to how much exercise they're able to do. And in order to do that, it's very important that you do it in a simple way, because complicated advice regarding monitoring outside the context of a hospital setting is likely to lead to confusion, and also it's highly unlikely that that particular patient will be able to follow it. So what we tried to do with that particular paper was to provide individuals with two simple things. One is a measure of their heart rate, which most of us are able to measure fairly easy, and we've got very cheap gadgets that individuals can get or even use their smartphones. And the other thing is something called the Borg scale, which essentially it's a measure of what we call a relative intensity. So you're able to put an individual on a treadmill in your hospital, and then you ask them how they feel regarding exercise. Do they feel mildly out of breath, very out of breath? And then you're able to correlate that with their heart rate and explain to them that when you get up to that sort of feeling, that's the sort of level that I want you to stay at and not exceed that.